I'm Donald McCauley and welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today we're in Antwerp and I'm talking to Sibyl Anthierens. Now, Sibyl has a message for primary care. Tell us what you think, Sibyl.
I think we're at a momentum in time where social scientists can really have a voice in medical research and in the medical field in general. I think we need to work together. We've been working together for a long time, but properly together as equal partners to improve the field of medicine and to make sure that the evidence that we're building so far that it really gets implemented in practice. And not that it takes a very long time, like often now it takes more than 10 years for evidence to get really implemented in the field. But I think if we work together with different disciplines, we can take the field forward.
So what disciplines and how do we do it?
If we're talking about social sciences, it's a broad field. You've got the economics, you've got the social scientists, you've got the health behaviors, you've got the politicians. I can only talk about my own experiences as a sociologist and also very interested in the health behaviors. I'm working together with health psychologists. And I think we're using different methods than the medical field, which are often very like the clinical trials, and those are seen as the highest level of evidence. And of course, we need those methods, but we also need the methods that we're using as social scientists, like, for example, qualitative methodologies, where we are doing interviews with people and really looking at the context of the field of research and taking individual behaviors that can be complex and sometimes messy, but also the higher level in which medics or primary care physicians are working. So that whole context, not from just the individual level, but also the system level. How does that influence the way we do and act as professionals and patients? So the other added value of qualitative research is really that we can bring a different piece of the puzzle in looking at a certain phenomenon in research or a research problem. And it can really give very powerful messages that can enhance into actionable findings.
So let's look at each different component. So at the beginning, within the research component, how can medical research work more closely with social scientists in creating medical research?
I think it already starts at the priority setting of research. So I think there we need to really go into dialogue together. So as social scientists, together with the medical field, together with politicians, what are the priorities that we need to set and how can we tackle them together? Not in silos. So how can we work more closely together to really improve the field? And when I'm talking about social scientists, often they're seen as people who create these big theories far away from the field. But I really think we need to work together more closely and maybe even adapt our methodologies, but also from the medical field, and start talking the same language, a common language, and transform our methodologies to really work together and also to integrate our findings. Because often now, I've been doing research now for the past 20 years in a medical field, and often we're seen as the little add-on studies or the work next to the medical field. But I think it's important to work together and to integrate our findings more and think about how can we address and how can we look at it from a different angle, but really integrate the results together.
I was really interested in what you said about priority setting. But you said something that really caught my attention, and that was including the politicians. So how can we include the politicians in research setting and in medicine?
Well, I think it's for the priority setting. Well, obviously we need direction how to move forward. And I think engaging with policymakers from an early start on to create research that's relevant for the public, for healthcare professionals, and also where politicians can use the findings also in their policy. And I think it's something that we've learned during the pandemic when we work from early on with politicians or with policymakers and engage our findings and translate our findings into policies early on. It might be easier to translate them to practice.
We've got the policymakers, we've set our research priorities, we've done our research. How are we going to communicate it? How can social science help us communicate this research?
And that's also an added value, I think, of engaging with the social science, and that we engage stakeholders from early on, so that we talk to the people early on in the research, even in clinical trials, that we talk with the different stakeholders, whether it's the politicians, whether it's the healthcare professionals, whether it's the public, that we engage them from early on in the research and talk to them with our findings in the meantime, and also know how we can translate them to different stakeholder groups, even with patients. What are their priorities? What are their needs? How can we communicate findings to them that are relevant for them, that they understand? So we need to work together more closely with all the different stakeholders at different times.
One of the problems with qualitative research is that everyone thinks they can do it, and sometimes the qualitative research is maybe not that good. What do you think of that?
I totally agree, and we see a tendency that there's a lot more qualitative research out there, and I think it's very important that we train young researchers and supervise them, and it's a lot of work to properly supervise qualitative researchers or beginners in qualitative research, because it takes special skills, and it's not that you can do anything, because that's often what they think, that with qualitative research is just summarizing interviews of what people have said. But there's a lot more work to it, and you really have to work with the data, and you have to have good skills. And I think it's very important that we stay critical towards qualitative research and guide it properly, so that it really can gain the importance and the necessity that we need qualitative research in the medical field, but it needs to be done properly by good, skilled, trained researchers.
Let's look a little bit at some of the research that you've done, because some of the work is absolutely fascinating.
Okay, so lately I've been working a lot on international research on clinical trials during the pandemic, to see how we can help the professionals in the field, especially in primary care. And then a second bit is the silent pandemic on antimicrobial resistance. So how can we change prescribing behavior, optimize it? How can we help the public with the messages on antimicrobial resistance? During the pandemic, we've been working a lot together with primary healthcare professionals, and we set up research to see how interventions that were set out by the government, for example, on infection prevention strategies within the household, but households are seen as social systems. So we really need to know what's going on within those systems to see how those prevention measures will help. So we talked a lot with households, with patients who had the COVID infections, how they used those measures to prevent infections within their household.
You've done a lot of work on antimicrobial resistance and in these trials. Tell me a little bit more about that work.
Yes, I've been working for over a decade together with the social science team, with my colleague in Oxford, Sarah Tonkin-Prine. We've been working together with primary care clinical trial leaders in the field of AMR. We've been looking mainly at how we can change behavior of clinicians, but also on patients on seeking help for acute or common respiratory tract infections. And I think it's an ideal field as an example of how the social science can work really well together and get actionable findings that we can translate into practice. Because you can find interventions that work well, but we need to know why they work well. Is it the whole intervention, or is it different aspects of the intervention? It's really opening the black box of the intervention, but also not just for the clinical effectiveness of the intervention itself, but if we think further along in the future, how can we implement those interventions if they've proven effective? What do we need to know? What do we need to make sure that we address before we roll out on a big scale? And I think it's really a perfect opportunity for social scientists and clinicians to work together on AMR.
Clearly, you're very passionate about your research, and you've huge interest in research and in the whole breadth of research. It sounds to me like a task with no end. How do you manage work-life balance in that context?
Um, Indeed, it's a very difficult field to work in if you're passionate, but also all your colleagues are passionate about their work, and it can easily become 7 out of 7 job, which happened a bit in the pandemic. And I think we also need to set boundaries to ourselves, but also to our colleagues, that we need to have that work-life balance and need to step out of it a bit. And also I find when you take time to rest, you get new ideas, and I think it's better and healthier to get that work-life balance. But another thing in our job is, I think that the people we work closely with are most of the time people that we trust and have high respect for. And I think most of the people I've been working with have become friends over years, which makes it even better, I think. And it makes the research also better because we can really work as a team and we trust each other and we can speak freely.
Earlier this year, you recorded an interview on women in science and how to develop your career as a woman in science. What is your message for women in medical research?
You need to believe in yourself. Imposter syndrome is a very common phenomenon within in the academic field or within universities. And you need to find yourself a good mentor. Work together with a supervisor or with a team of supervisors. I think it's very important to work with a complementary team and people who really support you, and that you can make mistakes and that you can learn from those mistakes as long as you talk about it, and that you set priorities for yourself. Where do you want to work to? It's not the end goal that's the most important thing, but it's the journey along the way, and that you can move away from that journey, but that you keep what you like doing and what's important to you and what's important to society, I think is also very important. So surround yourself with nice, intelligent people who can support you. Help other people in there, not just females, but also male. Help each other and cheer for each other and celebrate successes, even little successes. I think it's very important to do that.
What a super note to end on. Thank you very much for talking to us today. It's fascinating to hear about your interests and how we can work more closely with social science, but also in teams and supporting each other. Thank you very much indeed.
Thank you.